To understand how neurostimulation works, it is helpful to understand how the body senses pain. Pain is the body's natural response to harm or possible damage. When harm or damage occurs to the body, pain signals are sent to the brain through nerves located along the spinal cord. Neurostimulation works by intercepting pain signals before they reach the brain. When a neurostimulation system is turned on, it sends mild electrical pulses to nerves along the spinal cord, diminishing the feeling of pain and providing what some describe as a pleasant massaging sensation, or in some cases, simply the absence of pain. A neurostimulation system is composed of three basic components that are designed to work together to help manage pain: a generator, leads, and patient controller. The generator is a small device similar to a pacemaker that sends the pulses to the leads. The leads are thin wires that deliver pulses from the generator to nerves along the spinal cord. Leads are typically placed in an area along the spinal column called the epidural space. The patient controller is a handheld device similar to a remote control that lets you adjust the therapy. While neurostimulation helps most patients receive at least some reduction in pain, not everyone responds in the same way. The amount of pain relief varies with each individual. Complications related to placement and/or use of the device may occur, including painful stimulation, loss of pain relief, and certain surgical risks such as paralysis. Be sure to discuss the risks and benefits of neurostimulation with your doctor. CE marking does not necessarily indicate regulatory approval status for all markets. Please refer to the instructions for use for a full listing of indications, contraindications, warnings, and precautions. RX only. Brief summary. Prior to using these devices, please review the instructions for use for a complete listing of indications, contraindications, warnings, precautions, potential adverse events, and directions for use. Indications for use. Spinal cord stimulation as an aid in the management of chronic, intractable pain of the trunk and/or limbs, including unilateral or bilateral pain associated with the following: failed back surgery syndrome and intractable low back and leg pain. Contraindications. Patients who are unable to operate this system or who have failed to receive effective pain relief during trial stimulation. Warnings, precautions. Diathermy therapy, implanted cardiac systems, magnetic resonance imaging, MRI, explosive or flammable gases, theft detectors and metal screening devices, lead movement, operation of machinery and equipment, postural changes, pediatric use, pregnancy, and case damage. Patients who are poor surgical risks, with multiple illnesses, or with active general infections should not be implanted. Adverse effects: painful stimulation, loss of pain relief, surgical risks, for example paralysis. The user's guide must be reviewed for detailed disclosure.